Maintaining the left parasternal position, the transducer is rotated such that the plane of ultrasound cuts through the heart along its short axis. By tilting the transducer tip down toward the apex or up toward the base, innumerable short axis sections are displayed. We will begin the short axis examination at the papillary muscle level. This is the anterolateral papillary muscle, and this is the posteromedial. Note that for this subject, the posteromedial papillary muscle has two separate heads. The ventricular septum lies between the left and right ventricles. Note that the right ventricle is incompletely visualized. In addition to the septum, the left ventricular segments include the anterior, lateral, and inferior walls. In real time, note the uniform contraction of all left ventricular segments. We will now tilt the transducer to image the left ventricle in short axis at the level of the mitral valve. This is a diastolic still frame with the anterior and posterior mitral leaflets in the opened position. This is the lateral commissure, and this is the medial commissure. All three tricuspid leaflets are also seen: anterior, posterior, and septal. In real time, note the normal opening and closing motions of the mitral valve, and again, notice the uniform contraction of all left ventricular segments. Next, the transducer will be tilted to the base of the heart, to the level of the aortic valve. In this still frame, the left atrium is visualized behind the aortic valve. This is the left atrial appendage. The right ventricle, right atrium, tricuspid valve, and atrial septum are only partially visualized. The right ventricular outflow tract curves anteriorly around the aorta, and here is one of the pulmonary valve cusps. A short segment of the main pulmonary artery can be seen beyond the valve. In this diastolic frame, the closed aortic cusps form a Y within the aorta. The right coronary cusp is adjacent to the right ventricular outflow tract. The non-coronary cusp is adjacent to the right atrium, and the left coronary cusp is adjacent to the left atrium. In systole, the valve opens with a triangular appearance. This feature is crucial in differentiating this normal three-cusped valve from a bicuspid valve. Pay attention to this feature in slow time. In real time, note the position of the aortic commissures at 2 o'clock, 6 o'clock, and 10 o'clock, and also note the motion of the pulmonary valve. Tilting the transducer superiorly, we reach the level of the pulmonary artery bifurcation. The aortic root above valve level is seen in short axis. Beyond the pulmonary valve, the main pulmonary artery is visualized in its entirety, and here is the bifurcation into the right and left pulmonary arteries. By maintaining a short axis orientation and sliding the transducer toward the apex, a short axis view of the apex can often be obtained. The apex of the right and left ventricles are separated by the apical portion of the ventricular septum. The apico-anterior, apicolateral, and apical inferior left ventricular segments can also be identified. The right ventricular apex is heavily trabeculated. Note the uniform contractility of the apical segments.